All right, if you're a cat owner, you already know. They can be a little particular, right? But what happens when that usual finickiness turns into a flat-out refusal to eat? It's a super common worry, but it can also be one of the most serious warning signs your cat can give you. So how do we know when it's time to really worry? Let's figure it out. Yeah, this is the big question, isn't it? The one we all ask ourselves. Are they just being fussy today, or is there something much more serious going on? Understanding that difference is absolutely critical, and it's exactly what we're going to break down right now. Okay, so first things first, let's get the lingo down. When your vet starts talking about your cat not eating, they might use a medical term that could throw you for a loop. Now, it is so important to get this straight. In the vet world, anorexia just means a loss of appetite. That's it. It has nothing to do with the complex human disorder we all know about. A great way to think of it is like a smoke signal. It tells you there's a fire somewhere, but it doesn't tell you what's on fire. So, this is where things get really interesting. This is the first big fork in the road for a vet. They have to figure out, is this true anorexia, where the cat has genuinely lost all desire for food? Or is it something called pseudo-anorexia, which is kind of wild because it means your cat is actually still hungry. They want to eat, but something is physically stopping them. So let's explore these two different paths because the potential causes are wildly different, and it'll help you figure out what might be going on with your own cat. When we look at pseudo-anorexia, that wants to eat but can't category, there's one word that just keeps popping up over and over again: pain. I mean, think about it. Horrible dental disease, a sore mouth, even chronic pain somewhere else in their body that makes it hard to bend down to the food bowl. You might see them walk up to the food, maybe sniff it, and then just turn away. It's heartbreaking. They're hungry, but eating is just too painful. On the other hand, true anorexia is a whole other ballgame. This is when they've genuinely lost their appetite, and the list of potential causes is huge. We're talking about anything from serious illnesses like kidney disease to something psychological like being stressed out because you moved the furniture. It could even be a weird side effect from a medication they're on. And this brings up a really common one that's easy to overlook. For cats, so much of their appetite is driven by smell. So if your cat has what's basically a kitty cold and their nose is all stuffed up, well, they literally can't smell their food. And if they can't smell it, as far as they're concerned, it's not food. It's like someone handing you a plate of cardboard. You're just not interested. So no matter the cause, the second a cat stops eating, a clock starts ticking, and it ticks fast. Honestly, if you take only one thing away from this whole explainer, please make it this next part. 24 hours. That's the magic number. If your cat has eaten little to nothing for more than 24 hours, it's time to call the vet. Period. No, let's wait and see. And the reason for this urgency is because of a very specific and very dangerous condition that's pretty unique to cats. It's a scary-sounding name, hepatic lipidosis, but you can just call it fatty liver disease. See, when a cat stops eating, its body panics and starts flooding the liver with fat to use for energy. The problem is, a cat's liver just can't handle that massive rush. It gets completely overwhelmed, clogs up with fat, and then it starts to shut down. This is especially dangerous for our chunkier feline friends. And this really drives home how serious this is. We're not talking weeks here. We are talking about a matter of days. A simple loss of appetite can cascade into a critical, life-threatening emergency in just a couple of days. So you've made the call to the vet, or you're about to. Are there any safe things you can try at home in the meantime? Yes, but, and this is a big but, these are just to try and tempt them. They are not a substitute for seeing a professional. Remember that link between smell and appetite? Try warming up their wet food just a little bit. That makes it way more aromatic and tempting. Or you could offer them something really smelly and delicious, like a tiny bit of tuna or some plain cooked chicken. Sometimes that's all it takes. Oh, and make sure their feeding spot is quiet and calm. Nobody wants to eat in a stressful environment. And now for a huge flashing red lights warning. Ready? Do not force feed your cat ever. It is incredibly stressful for them. It can make them afraid of you and their food, and worst of all, they could inhale food into their lungs, which can cause a deadly type of pneumonia. You will only make a bad situation 1,000 times worse. Just don't do it. Which brings us to your most important job as a pet owner. You are their #1 advocate. You're the one who knows when it's time to call for backup. So we have the 24-hour rule. But beyond that, if you see any of these other signs, it's urgent. Vomiting, weakness, hiding away when they're normally social, these are all clear signals that your cat needs immediate medical attention. And just so you can see how seriously the pros take this, check this out. This is an actual chart that vets use to assess nutritional risk. And look, even just eating a little bit less than normal for just 3 to 5 days puts a cat into a moderate risk category. It really shows you that even a small, sustained change is a major flag.
At the end of the day, nobody knows your cat better than you do. You're the one who notices the tiny things, right? The little hesitation before they eat, the fact they're not sleeping in their usual spot. That information is pure gold for your veterinarian. So please always trust your gut.
So the next time your cat turns up its nose at dinner, don't just dismiss it as them being picky. Pay attention. A cat's appetite is a direct line of communication about their health. The crucial question is, are you listening?